Think of this as if we were the weather service, we are letting you know that there is a Category 5 hurricane coming at us.
To give you a visual of what it's like every day right now in our hospitals, if you think way back to the video footage that the media covered when this pandemic started in Italy, in New York City, and you could see these hospitals being overwhelmed, the demand and resources, that's what it's like.
We do have warning. We do know that hurricane is coming. It's months out, but we can't wait till we can see it out the window before we do something. We have to act now to help reduce the impact.
Omicron will be in our region and very strong by the end of December, early January. It will be the dominant strain. It will begin to push out Delta. The transmission rate is 2 times higher than Delta, which was 3 times higher than the original strain. The growth rate doubles every 2 to 3 days. Here's the issue. Vaccine effectiveness after 3 doses is about 75%, according to some sources, and about 35% effective after 2 doses. So that's a strong argument for getting the booster. And that's the issue with Omicron. It reinfects people who were previously thought to be immune.
One thing to help reduce the spread of COVID is if you have symptoms, to get tested. Get your vaccination. If you have not been vaccinated, 5 times the risk of getting COVID, 11 times the risk of being hospitalized, and 12 times risk of dying. But also wearing your mask, washing your hands, using the hand sanitizer, and maximizing distancing when at all possible. Prevent that hospitalization, prevent that severe illness, prevent clogging up the healthcare system.
This week, we reached our highest level in the hospital, and about 1/3 of our patients are COVID positive right now that we're caring for. Additionally, there is a national labor shortage. In the state right now, there are 93% of hospital beds in use and about 96% ICU beds in use. And this means staffed beds. When we look at our patients that are in the hospital, approximately 80% of them are not vaccinated. And so we have the ability to change this.
The highest rates of infection that we've had since September have been in our children. In addition to our children, we're also seeing that higher rate of increase in our 30 to 39-year-olds, basically the parental ages.
850,000 people have died in this country from COVID already. 10,000 people have died in Wisconsin already from COVID. 70% of people who are dying in hospitals today are dying of COVID. We can potentially come together and stop this chaos. If we don't do it, I don't know who does it. And if we don't have any place to bring people in, I can't even begin to imagine what that looks like for our community. These are not outrageous things that have to be done. These are simple things that we should be doing for each other in this community to keep each other safe. This potentially could be bigger than anything we've seen before. And we must act.